Hi, everyone. My name is Dr. Michael Wald, and thank you so much for joining me for this very important discussion, which I call the popular supplement that could clear brain fog after a bad night's sleep. So, this will be a summary of an article that occurred in the Women's Health magazine and some additional information that I think is important for this topic. So we're going to, and namely, the supplement is creatine, and it is a naturally occurring compound that's found in our diets. We also can make it, and it's used probably most often by those in the strength building athletic areas, such as professional sports of all types, whether it be biking or weightlifting or powerlifting. You name the sport, creatine might have a value because it promotes not only muscle strength and muscle growth, but also ATP and energy production. And very importantly, it may offset brain fog caused by inadequate sleep. And it is generally safe. All right, let's get into it. To begin with, my name is Dr. Michael Wald. As I mentioned, I'm otherwise known as the Blood Detective. I've published several books, including the Anti-Aging Encyclopedia of Laboratory Tests, which teaches people and doctors how to nutritionally and medically read blood tests to figure out how much of supplementation, like creatine or any other supplement, someone should take. So I am a doctor of chiropractic as well. I did graduate medical school. I did earn my MD diploma. I decided not to become a licensed doctor, but I do have that knowledge. I'm a sports nutritionist with a master's degree. I have a PhD degree in holistic philosophy, and I have a board certification in nutrition, and I'm also a dietitian. I provide acupuncture and life coaching, all of those things simply because I've found over my over 30 years of experience that people need these different things, sometimes in different combinations, or some of them not at all. So I felt that the holistic mindedness, the holistic approach requires knowledge in this area. So that's what motivated me in this area. Okay. So the information I'll be presenting to you right now is for your educational purposes. It's not meant as a substitute for sound medical or health advice. So since we're talking about offsetting brain fog, which can be caused by either too much or too little sleep, let's talk about what this actually is. So brain fog is a state of mental fatigue, confusion, and lack of focus. That's what it is in simple terms. Poor sleep is one of the primary contributors to brain fog. And brain fog obviously does not allow a person to fully participate in life. Their learning and their awareness and their attention and other mental faculties are simply not working well. And that brain fog could also have secondary effects on other body systems. So lifestyle, diet, and supplementation are the natural areas used by practitioners like myself to improve sleep quality. So what is sleep deprivation? Because that's what we're actually talking about. So chronic sleep deprivation is, first of all, associated with increased risks of a variety of serious health problems that affect our morbidity and our mortality. Our morbidity is our quality of our life, and mortality is how long we live. And those would include, among others, obesity, diabetes, hypertension, heart disease, stroke, and mental distress. We're talking about these conditions being promoted by too much or too little sleep. Now, studies have shown that, as I just said, too short and too long sleep durations are significant predictors of death in certain populations. And I've actually provided a study reference here called Sleep Duration and All-Cause Mortality, and that was a systemic review if you want more information on that fact. Not enough sleep, too much sleep, both are bad. Let's talk about why. So first of all, according to medical studies, both insufficient sleep, as I just said, which is defined as less than 6 hours a night, and excessive sleep, more than 9 hours, are linked to higher mortality risks and are associated with increased risk of cardiovascular disease, various metabolic disorders like hypertension and high blood sugar and high blood fats, and weakened immune function. So this suggests, obviously, these observations that Optimal sleep duration is crucial for longevity, as any deviations from the ideal sleep range indicate underlying health risk. So, what are some of the roles of supplementation? So we know, and of course we're going to speak about creatine in a moment, but certain nutritional supplements are known to enhance cognitive performance in those with excessive amounts of sleep or not enough sleep. And these various nutrients work in a variety of ways, but overall they work by reducing inflammation and supporting neurotransmitter functions and improving blood flow to the brain. So reducing inflammation in the brain and nervous system, supporting neurotransmitters, which are those chemicals in between neurons that allow us to think and feel and have memories and all of that, and improving blood flow, obviously all fundamental to offsetting sleep-related issues like brain fog. And then there are scientific studies that support the use of a variety of natural functions. And I determine what nutrition a person needs based on their actual needs. And then, as I've said in many of my podcasts, once I determine a person's fundamental nutritional needs, then on top of those needs, we use some of the supplementation that more or less seem to be the ones that have the best effect in dealing with brain fog. Let's talk about one of them right now. And that would be creatine. So creatine, according to a variety of studies, improves alertness, concentration, and overall mental clarity. Studies suggest it might help counteract the effects of poor sleep and cognition in some of the ways I just mentioned, by reducing inflammation and helping to balance out neurotransmitters and also improving blood flow to the brain and other areas of the body. So creatine also enhances ATP production in the form of phosphocreatine. And creatine also reduces mental fatigue, again, by improving blood flow to the brain, and very importantly, and I can't say it enough, reducing inflammation in the brain and supporting the neurotransmitter function. So let's talk about some of the other effects that underscore why creatine is something you might want to consider for your brain fog. First of all, it supports brain cell survival. So by maintaining cellular osmolarity and what's known as mitochondrial stability, creatine prevents apoptosis, which is a fancy term for programmed cell death. That's a good thing to offset cancer. And that helps also to ensure prolonged neuronal survival. So the neurons live longer, live better in higher concentrations of creatine. And creatine also reduces inflammation in the brain by inhibiting various pro-inflammatory cytokines like TNF alpha and interleukin 6. Again, just fancy terms for inflammatory mediators. And by modifying those, we can reduce neuroinflammation. That's a good thing, which can lead to brain fog and various forms of cognitive impairment. And those symptoms of cognitive impairment may not just be brain fog. They might be depression and anxiety, for example, paranoia, all kinds of mental, emotional symptoms. And creatine also seems to stabilize mood and helps to reduce stress by influencing serotonin levels and also dopamine levels, which are neurotransmitters that are needed to manage the stress response and cognitive function. And creatine seems to enhance sleep deprivation recovery. That's the whole point of this conversation right now. Creatine replenishes phosphocreatine stores in the brain, compensating for energy defects caused by sleep deprivation, leading to improved alertness and mental performance. Let me just say that again. Creatine enhances sleep deprivation recovery. It does that by replenishing an important energy molecule in the nervous system and other areas of the body known as phosphocreatine. And the stores of phosphocreatine need to be optimal to support the brain, help the brain compensate for the energy defects, right? Because phosphocreatine produces ATP, which is energy, which is caused low levels by sleep deprivation. So this is going to improve mental performance and also alertness. So what are some strategies then to improve mental clarity? First of all, we need to prioritize consistent sleep patterns, what's known as sleep hygiene. You can take all the creatine you'd like, but if your sleep hygiene is off, if you don't have a routine, that's going to limit you and limit the results that you want to get pretty profoundly. We want to maintain a brain-friendly diet rich in antioxidants and omega-3s. They know that anthropologists have found skulls by ocean shores, let's say, and they realize that the skulls of those early hominids or early humans near the ocean shores were bigger, and therefore their brains were bigger. And as you go more inland, you find smaller brains. So omega-3s are very important for brain development and brain health. How much should you take? That depends on you. Ranges of omega-3s can vary from a gram to 12 or more grams a day, depending on what we're dealing with. Whenever we're dealing with any problem or any goal, let's say to reduce brain fog, we have to also recognize that people have underlying nutritional issues and other health problems. We have to consider the whole person when we're trying to improve their mental clarity. And by doing that, that might help us. In fact, it does help us optimize the level or the amount of the nutrients we're talking every day. I hope that makes sense. And we want to stay hydrated and engage in regular physical activity. Both of those things are known to improve brain health, improve brain fog. And of course, last but not least, we need to manage stress through mindfulness and relaxation. But even more important than those things, and they are very important, is recognizing the cognitive errors that you're making. Let's say your perfectionist attitude towards life. That will lead to anxiety and stress. Well, fundamentally because it's impossible to be a perfectionist. So any endeavors towards that will lead to issues with cognitive stress. To give one example. And then there are omega-3s, and what you need to know is that they're commonly referred to as EPA, DHA. So if you look on a bottle of fish oil products, it'll say EPA, DHA. And it's the DHA portion which is mostly the most important, I would say, for brain fog and brain and neurologic problems. And the EPA portion is ideal for cardiovascular problems. So if I'm dealing with a client who I believe has more cognitive issues and brain foggy type of issues, then I will choose an omega-3 prescription level or physiologically active, the best quality, I'm trying to say, of omega-3s, which has higher amounts of the DHA for cognitive issues. And if they have more cardiovascular, I would choose one that has more EPA ratio relative to the DHA, because omega-3s, and as I've said, the DHA in particular, supports neuronal membrane integrity, keeps the neurons healthy, and the fluidity of the brain, which is very important for repair in the brain, what's called neuroprotection. And also omega-3s help to support the ATP production by creatine. So there's a synergistic reaction between omega-3s and creatine. Both of these compounds, among other beneficial physiologic pathways, they help reduce oxidative stress, they help reduce neuroinflammation, they modulate a variety of detrimental inflammatory pathways, and creatine acts as an antioxidant within the mitochondria, which is why it's so effective for producing cellular energy, because the mitochondria, the powerhouse of the cell, is a major place in the body where ATP molecules are produced. And creatine also, as I've said a few times, I need to reiterate this, improves cerebral blood flow, which is oxygen delivery and nutrient delivery that creates a more resilient brain. And more resilient brain and nervous system against various stressors like too much sleep or too little sleep. So what are some of the ways that we can optimize the creatinine, or the creatine dose, I should say, for you or anyone else? So I like to use a body composition analysis, also known as a bioimpedance test, which is an electrical test where 2 electrodes are placed on your foot, 2 electrodes are placed on your hand in certain positions. A current is sent through the body. It goes through muscle, water, and fat at different rates because muscle, water, and fat have different densities. The computer extrapolates that and tells us what the percentages of muscle, water, and fat is. And the muscle, I should say really, to be more accurate, we're talking about lean mass, which includes muscles, and organs. And those are things that atrophy or shrink as we get older. So creatine may be a longevity promoting nutritional compound because it offsets the loss of lean mass. And what you need to know is that measurements of lean mass are the #1 biomarker predictor of morbidity and mortality. That test is that good for predicting your lifespan and your health span. So no matter what effort you make with nutrition, whether you take creatine or other supplements or eat a certain foods or you suck the wind, it doesn't really matter. If you're not improving lean body mass, you have not improved statistically your health span and your disease span. So I use the lean body mass measurement to dose a creatine. So this personalized approach, as I've said here on the screen, enhances absorption, minimizes waste, and optimizes cognitive and physical performance benefits. So generally speaking, I'll use something like a 0.03 to 0.08 grams of creatine per kilogram of lean body mass. And again, if there are other health issues going on with a person, I might increase that. So that's just a rough guideline. Now, there is something you should know about creatine and kidney disease or impaired kidney function. So fundamentally, you need to know that creatine is metabolized into creatinine, which is excreted by the kidneys. So individuals with kidney disease may have difficulty clearing excess creatinine, potentially worsening their kidney strain. So if you have kidney disease, speak to your doctor about the efficacy or the safety of you using a creatine. Also, any pre-existing liver conditions, while uncommon, high doses of creatine may place additional metabolic stress on the liver, particularly in those with liver disease. And then there are electrolyte and hydration risks. Creatine does draw water into the muscle cells, which is one of the reasons why they increase in size, but also may contribute to dehydration and electrolyte imbalances in individuals prone to kidney stones, excessive sweating, or inadequate water intake. And then there are some medication interactions you should be familiar with, and there are many of them. I've just mentioned a few here. Creatine may interact with nephrotic drugs, meaning drugs used for nephrotic syndrome, which is a type of kidney disease. These drugs include the nonsteroidal anti-inflammatories, diuretics, and certain antibiotics, potentially increasing the risk of kidney stress and dysfunction if a person were to take any of these medications along with creatine. And also, creatine supplementation can mimic renal disease on blood testing because it increases serum creatinine levels. So if you're taking creatine and your doctor says, I think you have a kidney problem, and you're taking creatine, that will look like kidney disease on testing. So before you get those kidney tests again, you want to get off of your creatine so you can have a clear pathway towards properly assessing if there's any kidney compromise. So very, very important. But also you should realize that even if creatine does increase your creatinine, which looks like some level of chronic renal failure, this does not indicate actual kidney damage, as the rise in creatinine is due to increased muscle creatine metabolism rather than impaired renal clearance. Thus, other kidney function markers like EGFR and BUN and cystatin C should be looked at to distinguish between what looks like chronic renal failure in a blood test compared to, is there really renal damage underlying that increased level on blood. So how to improve immunity the blood detective way? Why do we mention this? Whether we're talking about immunity or the nervous system or neurotransmitter function, mental health, and the topic of today, which is brain fog from sleep deprivation, we want to be holistic in our approach, looking at all aspects of lifestyle, not just thinking that if you take creatine, it's going to solve all your problems. For some people, it does, and it is relatively safe to try. And you'd want to have thorough laboratory tests, not just for renal function, as I've been emphasizing, but for other nutrient levels, because you want to know your overall nutritional status, because if you improve the overall nutritional status of your health and you take creatinine, you're going to have, creatine I should say, you will improve your response to it. We want to customize the food plans. We want to customize any other synergistic nutritions. We want to basically not think that just the addition of creatine is all that's needed. If you have brain fog and it's chronic and ongoing, and if you're not responding to creatine, there are clearly other underlying things that need to be addressed. But it is very hopeful that creatine might be a quick fix for some individuals. I've also provided some fact. I hope this conversation was useful for you. It was just an introduction to creatine. And once again, my name is Dr. Michael Wald. I'm the Blood Detective. Please let me know your thoughts on this particular presentation and any others that I have, which you can view on any podcast platform. Just search Ask the Blood Detective or on my website at drmichaelwald.com. Tons of free content. We'll see you at the next presentation. It was a pleasure. References here to some of the statements that I've made. I hope those are useful for you. And